Hello nurses and future nurses, welcome back to my YouTube channel. And on today's episode of Nurse Clement B, I am going to teach you on how to perform oral care to an unconscious patient. Alright, sit back and watch this video till the end. Do not forget to like, share and subscribe to my YouTube channel at Nurse Clement B, right? So sit back and let's perform oral care to this my patient, right? An unconscious patient. Remember, this is an unconscious patient, not conscious patient. So these are my requirements for this procedure. So I have long artery forceps, right? And I have my mouth guard, I have tongue depressor, I have my gauze swabs, and then I have mouthwash, I have Vaseline for lip care, right? Jelly for lip care, and I have my towel to protect the patient's clothing, right? So the first thing first is for me to identify this patient, right? Remember, this patient is unconscious. So the patient may have a relative by the side or the patient may be alone. So it is left for you now as the nurse to identify this patient properly. It is important that in nursing procedure or in medical science, you identify your patients before you perform any procedure to avoid performing procedures on wrong patients. So of course we have to identify this patient. So for this unconscious patient, of course, I am going to take my patient's folder. If it is on the system or if it's patient folder, I have to take cross-check the name, right? After cross-checking the name, I cross-check the name and I also check whether it's the right patient, right? I cross-check. If I'm not too sure, then I'll call my colleague to also cross-check for me. So you cross-check twice or 3 times to be sure that this is the right patient. Of course, an unconscious patient is a patient that depends totally on the nurse to take care of him or her throughout his hospitalization period or until the patient recover consciousness, right? So now, after identifying this patient, follow me, let's go and perform hand hygiene, right? I've done my gloves, right? So the next thing, remember, this is an unconscious patient and I have identified the patient and I've prepared my mouthwash and my mouth gag. So for the mouth gag, I have pediatric size and then adult size. So I'm going to use this adult size, right, to perform this hand oral care. Remember, I have to place my gauze inside and place the mouthwash in a receiver this way, and I protect the patient's clothing. I have to protect the patient's clothing, right? And also tilt the patient's neck right towards my side. So the next thing, after protecting and I've tilted the patient's head one side, then please, while you are doing this, do not leave it open, the mouth gag this way, and try to place it on the patient's mouth. No, you have to close the mouth gag this way. You have to close it this way, right? Close it this way. Have you seen it? Just close it this way. Then open the patient's mouth and place it this way, right? Open the patient's mouth, right? After placing it, then you open. So after placing it in the patient's mouth this way, right? Then you open the patient's mouth by pressing this button, right? You open it this way, right? And then leave it. Now you can see your patient's mouth very open, very wide. You can see right inside even the tongue, isn't it? You can see your patient's mouth, right? Yes. So after doing that, you take this long artery forceps, right? And then pick gauze this way. Please always wrap it. Always wrap it. Make sure that all the metallic aspect of the forceps is being wrapped. You wrap it round and then you clip it this way, right? So you can see the edge is being wrapped also with covered with gauze. Then I dip it inside my mouthwash. Inside the mouthwash, then I press excess. After pressing the excess mouthwash, remember when you put the mouthwash, you have to dilute, right? After pressing it, and I place the dissecting forceps back, and I start washing this patient's mouth. down, up, right? I wash, right? Then I discard this inside receiver for used, right? For used swap. I picked another gauze, right? Wrap it the same way. I keep wrapping it this way, right? Make sure that the edge of the forceps is being closed by the gauze. Then I dip it inside. Also press, right? I'll also press it. Press the excess fluid. And also I wash the palate of the patient's mouth. I wash it. So I keep doing this. I keep cleaning and changing the gauze till I discard it inside receiver for use instrument. So now I want to wash the tongue, right? I also repeat the same thing. I wrap my gauze around the forceps. After wrapping it, I also clip it and I dip it inside the mouthwash. Press excess fluids, right? After pressing, then I'm using wooden tongue depressor. Then I want to wash the patient's tongue, right? I press the tongue this way, I wash, right? Remember, if the tongue is falling, you also use this tongue depressor to like press the tongue and pull it back this way, right? As you can see, you just put it at the inside the patient's mouth and just press it this way and pull it back. So I want to wash the patient's tongue. I support it with my tongue depressor and I wash. After washing, after cleaning, then I discard it. Then I pick another. Remember, you keep doing this until you have the desired result, right? So I dip it again. I'm using this one as the last one. Then I use my dissecting forceps, plain dissecting forceps to remove excess fluid. Then I clean my patient's mouth, right? Then I discard it inside my receiver. So I discard this inside receiver. Now that I am done, then I remove the mouth gag. I open this way. Please always do not leave your patient and start struggling like this to remove the mouth gag, right? So always press this button, this one, use your index finger, press it, close it this way, then turn it this way before you remove it from your patient's mouth, right? As you can see, it's very easy. Then you discard it inside receiver for used instruments. Now the next thing is for us to give lip care to this patient. I have to dip face towel inside warm water. After dipping it, then you clean the patient's face, right? You clean. Remember, you have performed oral care, so you have to clean and clean. Then you discard. Then you give a little care, lip care. You apply jelly on this patient's mouth, lips, so that the lip will not crack. Remember, this patient is unconscious. It's totally depending on you, right? Then you apply, give lip care. After which you are done, you discard used equipment. After discarding the used equipment, you make the patient comfortable. Remember, we have made this patient, we've tilted the head. So now remember this patient is unconscious. So now that I'm done giving this oral care, the next thing now is for me to remove my glove and done hand hygiene. So follow me, let's go and perform hand hygiene as I remove my glove, right? So I discard it also inside a receiver for used instruments, right? So let's go and perform hand hygiene. I perform hand hygiene, right? So remember that this is OSCE, right? So you have to rearrange used equipment, trying to prepare for the next candidate to come. So you tell your examiner that I am discarding used equipment by rearranging them because of the next candidate. Then you discard this one inside a bin, of course. So thank you for watching this video till the end. Thank you for your like, share, and subscription. Thank you. I have come to the end of this procedure. Thank you. God bless you. Bye-bye.